Have you done physical therapy and are still experiencing chronic pain? Well, you are not alone. Today I want to just talk briefly about why physical therapy isn't always the fix to chronic pain issues. So my personal story. So over 3 years ago, I was in a car accident where that triggered my chronic back pain that I dealt with for many years before I ended up being able to fix it, mostly on my own, after seeing all of the people, all of the doctors, doing all of the things, and nothing worked well enough that really stuck. My pain kept coming back. I would get temporary relief, but nothing really fixed it. And there's a reason. So when we're talking physical therapy in particular, physical therapy is great. I don't want to down physical therapy. It definitely has its place. However, a big issue with physical therapy, and this is specifically when you go through insurance, and if you don't go through insurance, physical therapy can look a little different, and I've done both. I've seen 8 physical therapists in a regular traditional manner, and then I've seen multiple other ones as well. So I've been through quite a few physical therapists, ranging in specialties from very general to pelvic floor to like strength and conditioning, coaching with physical therapy, and none of it really stuck. And I hear this all the time from my clients. My clients have seen, multiple physical therapists, and just most of them get some relief, especially with the manual work that physical therapists can do, that is what I think a lot of the value is with physical therapy, is being able to really specifically dig into spots that are causing issues, and that can be through, just their hands, more of massage, that can be through electric stimulation, cupping, dry needling, scraping. There's a lot of tools that they're able to use, which can be quite useful. But physical therapy is really designed for people to get a decent amount of their range of motion back. And I use range of motion very specifically. It's not mobility, it is range of motion. So let's say, for example, a really common issue is shoulder issue. So partial tear in a rotator cuff. I see that super regularly. That's a really common issue. So what is a physical therapist going to do? They're going to work on a lot of rotator cuff exercises in different ranges of motion, hopefully with bands, potentially with weights. And then maybe do a little bit of really light strength training. They might, depending on what the person's, upper body looks like, they might do some rows with bands, a lot of different ranges of motion with bands specifically. And once you typically reach about 70 to 80% of the natural range of motion, or you stop improving, once again, especially through insurance, that's it, you're done. And that could be 2 weeks, that could be 4 weeks, 6 weeks, 12 weeks. I'd say probably 4 to 8 weeks is pretty common when it comes to physical therapy. But the biggest piece that most physical therapists, not all, most physical therapists is missing is, one, the mobility. There's not a lot of mobility. For example, when I was going for my lower back, there wasn't a lot of work except on my lower back, specifically in, I did a little bit of cat camel, but I honestly, that was it. Bridges, really basic things that are fine, but aren't really challenging or strengthening different ranges of motion. And that's really the key when it comes to mobility work. It's strengthening ranges of motion. So one, you have to strengthen that range of motion, which is mobility work, and that's where I start pretty much all my clients at. And then piece number 2, which is the biggest thing, and this is why physical therapy oftentimes doesn't stick, is the strength aspect. Because even if you fix the mobility issue and the ranges of motion, if you don't strengthen that, your issue is going to come right back. It's not going away. You didn't fix and strengthen these new movement patterns, which are going to cause a lack of pain, because these are your natural movement patterns. And that's so, so, so important. So we have to, focusing on strength is so important, because if you don't strengthen these new ranges of motion, you're going to revert back to old patterns, old problems come back. That's why people have chronic pain. It keeps coming back over and over again. The other piece I will say, that once again, if you go see a very traditional physical therapist through insurance, no one looks at anything other than your problem area. And I would say all but 2 of my physical therapists did that. And one was through insurance and one was not. And before that, everyone only looked at my lower back. They're like, your lower back hurts. We got to look at your lower back. Well, that's great, but what about everything around it? What about everything else that affects my lower back? No one looked at that. No one looked at my hip mobility, my internal and external rotation. And also, when someone finally did, I will say, according to the normal ranges of motion, they were fine, but for my body and my strength, they were insufficient, which is part of the reason I still had pain. So it is definitely individualized, and it varies person by person, which is a lot of times the system isn't designed to let physical therapists do that. And a lot of it has to do with these systematic issues in a lot of Western medicine when it comes to chronic pain. So we really need to look at it, the way to fix chronic issues is we need to look at a person as a whole. We got to look at the whole person, because I will say 99% of the time when I do an assessment on a client, and once again, let's go with the shoulder. So they've got a partial tear in their rotator cuff, they have shoulder pain, limited range of motion, they can't come up above their head, they have pain when they bring their arm away from their body, super common. But what else is going on? Probably they have forward shoulder. Probably there's discrepancies between the 2 shoulders in strength because there's been some compensation. Even in their back, a lot of times people will have these compensation patterns that they are completely unaware of, which is super common. I was there too. I had to fix my own compensation problems. They're still not 100%. They're about 90-95%, but they're not 100%. But we have to look at these compensation patterns and look to see what else happened. If we're talking shoulder, I almost guarantee the mid-back, the thoracic spine, there's probably some rotational issues there. There's probably some limitations, especially on the side of the shoulder that hurts. Lower back, I'm looking at hips, I'm looking at ankles and feet. I'm also looking, once again, at that thoracic mobility. I'm looking at upper body, I'm looking at shoulder mobility, because our bodies are a whole. Our bodies don't operate one piece at a time super separately. We are a whole person, whole individual, and that's what we need to look at. We need to look at whole people and look at their issues as a whole body, full problem. Let's see the whole picture and see what's going on and address it like that. Not address it just your shoulder, just your back, just your knee, just your feet. It doesn't work like that. Just your neck. The neck's a super common one too. And there's a lot of, it's usually not actually the neck. Usually there's some other stuff going on around it. So really, it's so important. If you've been to physical therapy, if you've been to many physical therapists, I want to let you know that you're not alone. There is hope to fix your chronic pain, and there's a better way to do it. There is a solution. I've done it on myself. I've done it with many clients now, dozens of clients that have had success in fixing their chronic pain, and it's gone. It's gone for good. And that when that happens, it is life-changing.